The whole idea with the lobby and what they were trying to do with the design was to make sure they didn't have a traditional waiting room where people were stacked up. And see, the idea was with furniture and things like this, Winding Waters and the Wellness Center kind of came together and says, let's do it more like a concierge than walking up to a window and being pushed around like a grocery store. And so the concierge would greet whoever comes in, quietly and privately, and kind of determine what they're needing and where they want to go, and help guide them in those directions. But the idea is to make it more seamless, less get in line, take a number, and do that, to make it more inviting. Initially, when we were doing this project, we were planning on having a commercial kitchen so we could produce a lot of stuff. But then we realized, how could it function doubly for the community? And so what we've done is we've created a learning kitchen where people in the community can learn to cook healthy foods, can do farm to table, can use it for catering events. It's multifunctional. There's gonna be media on that wall, a screen where people can follow instructions, give instructions, but it's a two-way media screen, so someone could give a distance learning course, or someone who's homebound is also able to participate in a class. One important part of this kitchen is all the appliances are not commercial. They're going to be home-based appliances. That allows us to still do catering, still do projects, but it also, the most important thing is the learning aspects of this kitchen. It's pretty exciting. It's something that we've dreamt about for a long time, and we're hoping that it's going to really serve the community on a number of facets.
Here is our dental suite. So we'll have 4 dental operatories in this building. And there'll be dividers between each operatory. There'll be these 3 here with a nice view. There'll be that dental operatory over there. Not as much of a nice view, but we'll have a nice screen on the wall so folks can watch something. There'll be room for a panoramic x-ray over here to get a full view of your mouth and be able to take care of folks here for things we can do, and then also when we refer people to specialists, we can send them with all the data they need to really do a good workup and get people treatment without having to make many trips out to see a specialist. More exam rooms. Right here is our vital station. If you've been in for care at Winding Waters, for sure you've been through a vital station, had your blood pressure checked, temperature checked, your weight taken. So this is where folks will have a private place, get screened like that, and then come in for medical or dental or behavioral health visit, depending on what they're in the building to do. Right around the corner here is our medical lab. So if you need a blood draw that we do, we'll do it here. There'll be some workspace in here for our team to do some of the lab work that they do and analysis that they do. Here is a kind of an entryway and a conference room for those meetings that we need to gather more people. What I noticed as the framing went up, and I'm driving in on Medical Parkway, this feels like a welcoming face to the building too. And I'm sure the architects did that on purpose, but I've actually had some folks ask me now, is that the main entrance? And I said, no. But I'm glad to hear you ask, because it's a kind of a welcome face on Medical Parkway that I didn't understand as part of the design until I drove by and went, oh, that's pretty smart.
This is kind of a fun office. It's an observation office, and it'll have a 2-way mirror here. We're doing a lot of therapy right now where we literally stick an earbud into one of the ears of a parent who's having difficulty with engagement or play with their child. And so the therapist can stand behind and guide the parent through the earbud about different ways of engaging the child. These are just clinical offices that anyone can use. As you saw in the other side of the building, there are big pods where everyone sits collectively as teams. And so then we run this model called a lean-based model, and where we check out the offices. So the office isn't owned by any one person. It's an office that's meant to be super flexible. And what that does is it actually increases the number of offices available per day. This is the co-joint break room, and out this big door here is going to be outdoor eating. All that to the outside is going to be landscaped. There's going to be picnic tables out there as well for folks to eat inside or out or just take breaks in here. Janet, and it'll eventually connect to the hospital and to the ball fields. The fairgrounds has talked about making a walking path as well, so we can make it all one. If that happened, it would be about 2 miles. So that would be a really nice distance, I think. This space in here is another work open type space. It'll have a small conference table, some breakout like furniture, maybe some chairs, comfortable chairs. These are offices for support staff. So financial department, HR, but none of the offices are occupied by one person. They at least have 2 people in every single office because again, we're trying to be conservative with space. It's already a, 18,000 square foot building. This space right here is our leasable space, and we're hoping that the VA clinic signs an MOU and it brings the clinic, and the Veterans Affairs Officer would probably occupy that office right there that Lem's leaned up against.
This expansion is really important. We're not replacing any space we already have. This is expanding into this building because we're full up over in the main clinic and in our clinic in Joseph. The Triple H is a really busy place. We hope to bring some of that complementary care here. And so this is expansion for us. It's a success story.